The emergence of the highly mutated Omicron variant underlines just how perilous and precarious our situation.
COVID is a nasty illness, but it's not as bad as it could be by any stretch of the imagination, and it's some multiple worse than a bad flu epidemic.
The new COVID variant, first identified last week in Southern Africa. And if you are not vaccinated, now's the time to get vaccinated and take your children to be vaccinated.
I've just literally learnt from my news service here in Australia that President Biden has decided that all companies in America who employ more than 100 people must ensure that all their workforce is vaccinated. That's 80 million Americans, compulsory.
Too much force is going to have to be applied to people to get them to do that, and many people will just not do it. We need to talk very seriously, all of us, about the cost of the safety, because the cost isn't safe, right? So we're taking one risk to prevent another. And so it's always a matter of balance of risk. There isn't a pathway to safety through all of this. And so I'm also concerned, to make the vaccines mandatory is going to do, and to punish people who refuse them for whatever reason they refuse them, it seems to me that it's a sign of the failure, the vaccination arguments, essentially. If you haven't made the arguments credible enough to convince the percentage of people that you think should be vaccinated to be vaccinated, then that's a failure of your argument. And then to move to use political force and police force, for that matter, obviously, to insist is only going to increase the distrust that's driving the resistance to the vaccines to begin with. You spoke at the beginning of people's decrease in trust in the medical establishment, so to speak, and also in the political establishment. When those systems resort to force to impose their view of what the proper pathway is to safety, that's going to produce a long-term, permanent, serious damage in the credibility of those institutions, and that's going to have a tremendous cost in terms of health as well. And then I've been trying to think through a solution. So in Canada, we have a fairly high percentage of people that have been dually vaccinated. And it seems to me that the appropriate approach is something like for the governments to say very honestly and carefully to people, we've made the vaccines as available as possible to all of you. There's nothing standing in your way but your own choice that's preventing you from being vaccinated. As a consequence, we're going to reopen our country radically on this date. And then your destiny is in your hands, as it should be. And it seems to me that hoping that the vaccination rates are going to exceed 90%, I think that's a high-end estimate, and I might be wrong about that, is a pipe dream. Too much force is going to have to be applied to people to get them to do that, and many people will just not do it. And then what are we going to do with those people? Are they now pariahs? Are they now criminals? And if they are, because it's going to be a big chunk of the population, how exactly are we going to deal with that? So I see that we're in danger of exchanging the possibility of pandemic damage with the certainty of the danger of authoritarian imposition. I'd like you to respond to that, I guess, and tell me what you... So that's what I think the policy should be, is that we have the vaccines, that they may not be as accessible in Australia yet as they are in Canada. We have plenty of vaccines in Canada. I think the government and the health authorities would be much more credible if they said, look, we really think these vaccines work, but we're not in the business of forcing them on you. You can make that choice. We've done what we could to provide them for you, and now it's in your hands. And is that a stupid idea? Because I don't know, but I'm not impressed by this creeping authoritarianism in the name of public safety. I just can't see that that's going to go well. I think it's going to cause more damage than it's going to do good. The problem with returning fire with fire, I suppose, is that you end up burning, and I've had enough of that, I would say. So it's best to try to calm things down if you can possibly manage it, and hopefully I'll have done that at least to some degree and might continue to do it. The willingness to dispense with civil liberties on the domestic front in the face of the pandemic threat. And I wonder first about the legality of such moves. It seems to me that if the lockdowns and the mandatory vaccination policies are in fact constitutionally valid in countries like Australia and Canada and perhaps the US and of course Europe, that our civil liberties aren't very well protected at all. What will happen to us, broadly speaking, when the next influenza pandemic sweeps through? Like, now that we've established lockdowns as acceptable, what level of threat justifies their imposition? How serious does it have to be? So then I worry about the lockdowns and certainly about the ethics of the mandatory vaccination campaign. Now, I'm vaccinated twice, and my wife is as well, although I have family members who have refused it. And so the division that you see politically and philosophically runs through my family. And I'm not claiming any moral superiority in the fact that I got vaccinated. There are a variety of reasons for it, and I won't go into them. But I'm sympathetic to those who are leery of the mandatory vaccination as policy, or the vaccinations per se, because they have health objections or ethical objections.
I've just literally learnt from my news service here in Australia that President Biden has decided that all companies in America who employ more than 100 people must ensure that all their workforce is vaccinated. That's 80 million Americans, compulsory.
You said that that's the company's responsibility to ensure that. So does that mean that the decision about what healthcare is appropriate has now been ceded by the US government to corporate interests? And where the hell is that going to end, precisely? I mean, COVID is a nasty illness, but it's not as bad as it could be by any stretch of the imagination, and it's some multiple worse than a bad flu epidemic, but it's in the same general ballpark. And so these precedents are being established at an unprecedented rate, and there's a principle underneath it, which is, well, you can't be too safe. And the answer to that is, or the rejoinder to that is, that may be true, but don't be so sure that the policies that are put in hypothetically to ensure your safety are going to have that effect and no others. And so, and I know there's a professor in Canada who's, and I only know the edges of this story. She's a professor of ethics, and she has been questioning the mandatory vaccination policy on Nuremberg grounds, essentially, that it's a violation of that enforced medical treatment, the idea that medical treatment can be enforced by the state. In one of our provinces, there were no exceptions, no religious exceptions, no exceptions for health reasons, no exceptions, period. It's like, okay, but where does that end? Like, what is it? I do all sorts of things that are hypothetically dangerous to other people, like drive, for example, which I suspect is far more dangerous than COVID, and yet I'm allowed to do that. You know, we're setting a very strange precedent here. And that's a hell of a law that's just been passed.